Hello, ladies and gentlemen. My name is Isaac Christopher Lubogo. Today we want to talk about organ trafficking, or perhaps organ donation is a much better word. And I'm invoking what they call the Uganda Human Organ Donation and Transplant Act of 2023. But first of all, what is organ trade? Let's begin that way. Yeah, let's place the subject into context. Sometimes also known as organ trafficking. Fundamentally, organ trafficking is basically an illegal trade of organs. Typically, in terms of transportation, and the practice involves exchange of organs such as kidneys, liver, hearts, and even more often, involves the exploitation of vulnerable people for purposes of getting money. But without really going into the intricacies of the legality of it, I first want to argue from an intellectual perspective. The organs that are basically involved include things like kidneys, and other vital organs, maybe like liver, the heart, the lung, which can be traded, but they are usually obtained through certain complex and even risky means. And they also involve what they call vulnerable donors. And so these traffickers often target vulnerable individuals, such as impoverished people, sometimes prisoners or refugees, who may actually be willing to sell their organs due to financial desperation. But we'll understand the legality of it when we come to that. I don't want to be misunderstood. Then recipients, sometimes wealthy or critically ill individuals who often need these organs for purposes of transplanting, by way of getting the organ from other people to their bodies. And then it involves some kind of black market, sometimes illicit brokers or medical professionals who facilitate this kind of transaction, and these brokers actually connect with potential sellers or buyers. And as such, it has actually gained what they call ethical concerns, meaning that organ trafficking, which is illegal, raises significant ethical and even legal concerns, as it exploits, as I say, donors and possesses serious health risks. It also undermines the principle of what they call equitable and regulated organ allocation. In terms of the legal status, most countries may not engage in organ trade. However, there are those that engage in proper, substantive, or legal organ trade. But there are also criminal, liabilities that may be insured. In terms of that, there are health challenges that may ensue because of not going proper medical screening or testing, or even transmitting diseases and complications that have to do with both donors and recipients. So it's a complex thing, really. In terms of a global perspective, organ trafficking basically becomes a global problem because it involves what they call international networks, and usually efforts to combat it among law enforcement agencies and even healthcare providers has become something that is extremely important. There is no doubt that there's quite a number of efforts that have been made to combat organ trafficking through increased regulation, in terms of awareness, in terms of ethical organ donation, for example, in terms of programs that ensure that organs are actually obtained and transplanted in legal and ethical manner. So the legality in terms of organ trade basically varies around the world, but in many countries it is illegal. But I'm going to give you some substantive undertaking of the legal status that may be engaged in terms of organ trafficking. Now, illegal in a sense that in most countries organ trade is prohibited in the majority of countries, and therefore laws that criminalize organ trafficking are in place that prevent exploitation of vulnerable individuals and maintain the ethical standards of organ transplantation or transplanting for that purpose. And then sometimes this is what they call legality in certain countries. There are a few countries where certain forms of organ trades are actually legal, often involving living kidney conditions between family members or other regulatory programs. So these countries typically have strict regulations in place to ensure the safety and ethical standards of organ transplants. In terms of an international perspective, organ trafficking also has been addressed in terms of the international level. For example, the World Health Organization and other organizations have actually established guidelines and even frameworks that combat organ trafficking to promote what they call ethical organ donation. And therefore, it calls for substantive enforcement. In terms of enforcement, the enforcement of organ trafficking, in terms of the laws, vary from country to country. In other words, in some places, the law enforcement agencies actually actively, combat illegal organ trade, while others, may encourage the trade, but have to do it in a legislatory or substantive framework. And there are penalties that come with it, penalties in terms of involvement, in terms of organ trafficking that can be severe in many countries, including imprisonment and even substantial fines, including Uganda, as we shall see. So the regulation of these organ trade or organ donation, it should be understood that in countries, for example, where organ trade is legal, there are legal and registered organ donation systems in place, and these systems are designed to ensure that organs are actually obtained and even transplanted ethically and equitably. So it's important to note that despite legal prohibitions, that underground organ trade countries or continues to exist in many countries under the world, due to the high demand for organs and potential in terms of significant financial gains. There are significant efforts to combat organ trafficking, which involves strengthening legal frameworks, raising awareness, promoting ethical organ donations in terms of practice that need to regulate the trade. So legal organ trade, often referred to as legal organ transplantation, involves regulated processes and even what they call ethical practices to ensure and safeguard and voluntary donations in terms of these organs. So we're going to discuss how it can be done or carried out in a legal way. One of the ways that it can be done in a legal way is what they call voluntary donors, where we're arguing that legal organ transportation relies on voluntary or organ donors. These donors may actually be living or deceased, depending on the organ in question. And then there's what we call living donors. So in the case of living donors, they actually typically donate organs such as kidneys or parts of their liver or perhaps lung lobes. So living donors are usually family members or even close relatives of the recipient, and they go through medical and even psychological evaluation to ensure their sustainability in terms of this donation. And then sometimes they're called deceased donors. Now organs from deceased donors such as hearts, maybe the lung, livers are also used for transplantation. And these donors are individuals who have actually chosen to donate their organs upon their death, or whose families have actually consented to organ donation after death. So if you realize, most of these things are extremely important and sensitive. And then there's what they call organ procurement organization, what they call OPOs. In many countries, OPOs are actually responsible for conducting the recovery of organs from deceased donors and ensuring that the donation process is actually carried out ethically and according to legal guidelines. And then there's what we call recipient matching, which is another super important part. Patients in need of organ transplants are actually placed on waiting lists, for example, in terms of organ allocation, and it's typically based on factors like medical urgency, tissue compatibility, and waiting time. So the allocation process aims to be fair and equitable. And sometimes we also have to carry out what they call medical evaluation, in terms of both living donors and recipients. They undergo what they call comprehensive medical evaluation to assess their sustainability in terms of transplantation and also to minimize the risks. Obviously, there's also what they call informed consent, which is extremely important. So all donors and recipients must actually provide informed consent, understanding the potential risks and the benefits of the transplant process. And then there's what we call surgical procedures. Now, the transplantation, or what they call the transplantation in terms of surgery, is usually performed in a licensed and accredited medical facility, often a hospital with a transplant program. So it involves highly skilled medical professionals, including surgeons and what they call anesthesiologists who carry out the procedure. And then what they call also post-transplant care, where the transplant recipients require lifelong medical follow-up to care and ensure in terms of assessing the transplant and also to monitor for potential complications. And then regulatory oversight in terms of the legal organ transplantation, or in terms of is usually subject in terms of strict regulatory oversight by government health agencies. So transplant organizations and medical ethics committees, these bodies established and enforce guidelines in terms of regulating the ethical and safeguard of these practices. Another important aspect that you need to comprehend is what they call donor and recipient privacy in terms of the identity of the donor and the recipient. It's typically kept confidential to protect their privacy and reduce the potential for what they call undue influence or even coercion to that effect. So even as we argue organ trade for that purpose, legal organ transplantation programs basically aim to prioritize the ethical and safety aspects of organ donation and transplantation in terms of that, which focuses on ensuring that organs are actually allocated based on medical needs rather than financial incentives. In terms of regulation, in terms of oversight, which play a crucial role in terms of maintaining the integrity of this program. So it's important, my friends, that the most common organs usually that involved in transplantation or transplantation, basically things like the kidney, followed by the liver, the heart, the lungs, and these organs are in high demand due to the prevalence of organ failure and the potential for life-saving treatment. I'm going to give you the why and how these organs are actually commonly transplanted for that purpose. Now let's begin with the kidneys. In terms of the kidney transplantation is the most common because it is possibly, in terms of its safety donate. For example, one of your kidneys can actually be donated and still maintain the normal kidney function in case you have one. So also kidney disease is relatively common, so often caused by common conditions like diabetes and even hypertension. So living kidney donation is common, with a living donor typically donating one of their kidneys to a recipient, and deceased donors can also provide kidney for transplantation. Please understand that this is not an argument for organ donation, but it's just an intellectual discourse to comprehend why. The whys, the wheres, and how they happen. Liver is another question. The liver is a vital organ, and it can be transplanted in terms of giving effective cure. So liver diseases are also common in terms of hepatitis or even alcohol-related liver diseases. So liver transplants can actually be from living donors who actually donate a portion of their liver, from deceased donors in terms of split liver transplants, where a deceased donor's liver is actually divided between two recipients and also performed in some cases as required. The heart is another one in terms of a transplant. So heart transplantation is also necessary when a patient's heart is no longer probably able to pump effectively, often due to conditions like what they call the cardiomyopathy, or what they call congenital heart defects or severe coronary artery diseases. So heart transplants are primarily sourced from deceased donors, and these donors typically are individuals who have actually chosen to donate their organs upon their death. It's very common. And then the lungs is another aspect in terms of organ donation or trade for that purpose. Lung transplantation is essential for individuals with what they call end-stage lung diseases, such as pulmonary fibrosis or even chronic obstructive pulmonary diseases, what they call COPD, or even septic fibrosis. So lung for transplantation it comes from deceased donors in terms of what they call the lobe, and may be considered in terms of lung transplants where a living donor donates a portion of one lung perhaps. So the transplantation or transplantation in terms of these organs is basically complex and highly regulated process, and recipients are carefully selected based on, again, on medical need, compatibility, and other factors. So while donors are actually rigorously screened to ensure the safety of these parties, it's important that ethical considerations in terms of informed consent, medical evaluations play a vital role in terms of transplantation to ensure the best outcomes of both the donors and even the recipients. So the aim, again, is to save lives and improve the quality of life for those in need of the vital organs. If you're arguing in terms of lungs and heart-lung for that purpose, lung transplantation is crucial for patients with end-stage lung diseases, and it can significantly improve their quality of life and overall health. In terms of the heart-lung transplantation is necessary when both the heart and lungs are actually affected by severe diseases, such as congenital heart-lung defects. And then there's the pancreas as well. Pancreas transplantation is actually often informed by individuals with what they call type 1 diabetes, where the pancreas can no longer actually produce insulin. So pancreas transplantation can actually be suigeneris with the kidney transplantation in terms of simultaneous pancreas kidney transplant, what they call SPK, or as a solitary pancreas transplant, where pancreas after kidney transplant, what they call a PAK, living pancreas donation, becomes extremely rare in some cases. And there's also what they call the intestines. Intestine transplantation is actually typically needed in terms of cases of what they call intestinal failure, often due to diseases like maybe short bowel syndrome, for example. So intestine transplantation is complex and it requires highly specialized surgical techniques. Deceased donors are actually the primary source of intestine for transplantation. So, and then there's what they call corneals. Yeah. Now, corneal transplantation is common and highly successful procedure for restoring vision in individuals with what they call corneal disorders or injuries. So corneals can actually be donated by a deceased individual, and the procedure is actually relatively straightforward compared to solid organ transplants. And then another kind of organ transplant could be what they call tissue and blood. So in addition to solid organ transplantation, tissues such as skin or even bone and heart valves can actually be transplanted, yeah? So blood transfusions and bone marrow transplants are also common, and they help in what they call common life-saving procedures. So it's important when you're talking about this kind of trade to note that the success of organ transplantation basically depends on various factors, including donor-recipient compatibility, the skill of the medical team, the post-transplant care, the organ transplant programs that rely basically on ethical principles and on a commitment to a well-being of both donors and even recipients. So the ultimate goal is to save the lives and improve the quality of those suffering from what they call organ failure. An emphasis could also be in terms of bone marrow. Why? Because bone marrow transplantation is actually used to treat various conditions, including leukemia, lymphoma, and even certain inherited blood disorders. So what happens is that the bone marrow can actually be harvested from a compatible donor, often a family member, and transplanted into the recipient after what they call chemotherapy or even radiation therapy. Another, which is also important, is what they call skin. Skin grafts are actually performed to treat burns and even chronic wounds and even skin disorders. So sometimes donated skin, usually from deceased donors, can actually be processed and even used for grafting in patients with skin injuries. Then also you could argue in terms of what they call heart valves, where heart valves in terms of transplantation is necessary for individuals with heart valve diseases. And so basically donated heart valves, typically from deceased donors, can actually be used in valve replacement surgeries. And then there's what we call coronary arteries as well. Now when you're arguing that, coronary arteries in terms of transplantation is rare but may be required in complex cardiac surgeries. So coronary arteries can actually be transplanted from deceased donors as well. Then also you could argue in terms of what they call face and hands. In terms of face and hand transplantation, it's highly complex and experimental procedures used in select cases, and basically involves severe facial disfigurement or even hand loss. And donors for face and hand transplantation are typically deceased individuals, and the procedure requires extensive surgical expertise. I'm laboring to go through these so that I can expose the entire thing of organ trade, so you understand that when we talk about organ trade, it's more than just the kidney. It's everything about the human body, really. These are what they call the isolate cells. The isolate cell transplantation is actually an experimental treatment to some individuals with what they call type A diabetes. So these isolate cells are actually extracted from a donor pancreas and even transplanted into the liver of the recipient. So my friends, listen, there are various types of transplantation procedures to save or even improve the lives of individuals who face a range of medical conditions. But it's important to know that each type of transplantation comes with its unique challenges, and the selection of the most appropriate type depends on the patient's specific needs in terms of availability of suitable donors and even resources. So it's very important that we get to understand. There's also what they call the uterus or uterine transplant. So uterine transplantation is an experimental procedure used to help women with uterine factor infertility, what they call the UFIs, that have a chance at pregnancy. So typically living donors, often close relatives, donate their uterus to the recipient through a complex surgical procedure. So after transplantation, the recipient may actually attempt to become pregnant through what they call vitro fertilization, or what they call IVF. There's also what they call vesicularized composite allografts, what they call VCS. Vesicularized composite allografts involve the transplantation of multiple types of tissue, such as hands, faces, and limbs, that are used to improve the quality of life of patients with severe disfigurement or even loss of limb. So deceased donors provide grafts which are then transplanted in complex and even surgical procedures. Please understand that these specialized transplantation or transplantation procedures usually aim to address unique medical conditions and improve the quality of the life of the recipients. They often involve high degree of medical expertise and careful patient selection to ensure the best possible outcomes. So it is important to know that not all these procedures are actually widely available, and many are actually considered experimental and performed in a limited number of specialized medical centers. But also, perhaps important, is what they call the penile transplantation. The penile, in the sense that penile transplantation is an experimental procedure to restore the genital function of individuals who have lost their penis due to injury or even illnesses. Yeah. So typically, deceased donors actually provide the penis for transplantation, and the procedure is actually highly complex and requires skilled surgeons. This is what they call Linux or voice box in terms of transplantation. Linux transplantation is actually an emerging field we use to restore the ability to speak and to breathe for individuals who have actually lost their voice box. Yeah. So the deceased usually donors can actually provide the Linux for transplantation, and involves intrinsic surgical techniques. Then also you may want to talk about what they call the thymus transplantation. Thymus transplantation is actually performed in select cases to help individuals with immune system disorders. So typical living donors provide the thymus to recipients, often children, who require this procedure. Another one that is extremely common is what they call hair transplantation, where hair transplantation is actually a cosmetic procedure used to address hair loss and even baldness. So what happens is that hair transplantation involves taking hair follicles or follicles from one part of the body and transplanting them to areas with hair loss. So it's incredible to know that everything about a body can actually be harnessed or harvested from one individual and given to another. And that's the danger, that's the gravity, and that's the seriousness. So these, as I said, they involve specialized transplantation procedures, which may be rare but are picking up in terms of science today, conducted in specialized medical centers with highly skilled surgeons, addressing these medical or cosmetic needs, and their availability to use are more limited compared to standard organ transplantation procedures. In terms of collineal limbo stem cell as a transplantation method also, for example, this procedure is used to treat severe corneal damage or disease by replacing damaged or even missing limbo stem cells, which are crucial for maintaining the health of the cornea. So what happens, the limbo stem cells can actually be obtained from a living donor, from tissue banks, and even transplanted into other recipient damaged cornea. The emphasis I'm making is that you guys who are looking, all of us really, we are affected in one way or the other, but we have to understand that we've been given these bodies with extreme important, entities that we have to take care of and protect. Because if we don't do that, science is developing at a very fast rate, and you realize that you're only lucky to have what you have, and someone is unlucky that they would need what you have. There's also what they call nipple area complex transplantation. In terms of it's an option for individuals who have undergone breast reconstruction to seek and restore the appearance of the nipple and even the areola. So what happens is that the donor tissue is actually transplanted into the recipient's reconstructed breast. Yeah. There's also what they call small bowel intestine transplantation. Yeah. And small bowel transplantation is necessary for patients with severe intestinal failure, often due to conditions like short bowel syndrome. Yeah. So the deceased donors provide for small bowels, and it requires highly specialized surgical techniques. And I'm wondering that if our bodies, even at the point of death, still have all these advantages and potential to be harvested, what is going to happen? Are we going to see burials taking place anymore? Are we not going to see shells, empty shells of individuals, perhaps that are being buried? Perhaps it begs that serious question of where people may have to find out their loved ones in terms of what has been done, especially when they are dead, how their bodies have been taken care of, why certain parts are missing. So in terms of advantages of organ transplantation, Both standard and in terms of solid organ transplants and specialized procedures are numerous and resolve around improving the quality of life. In many cases, saving lives. I'm going to give some advantages and the reason behind them. We have no doubt that organ trade, substantive, regulated, would save life. Organ transplantation is often a last resort for individuals with end-stage organ failure. So without a transplant, these patients may not survive. So transplantation actually offers a chance for an extended life. Number two is what I call improved quality in terms of the life. So transplantation actually can significantly improve a patient's quality in terms of life. For example, a heart transplant can allow someone with severe heart failure to regain a normal and active life. Yeah. Number three, in terms of treatment of what they call irreversible conditions. So in cases of irreversible organ damage or what they call congenital organ defects, transplantation actually provides the only effective treatment as an option. And then number four, in terms of what they call functional restoration, procedures like limb or face transplantation, which aim to restore not only physical appearances, but also function and the ability to perform daily activities. And then you could also argue in terms of what they call independence. Transplantation often allows patients to regain some kind of independence and reduce their reliance on medical treatments and even interventions. And then you could also argue it in terms of what they call psychological benefits. So many transplants or recipients report improved mental well-being and reduced psychological distress after their procedures. Obviously, I cannot leave out the argument of economic benefits. Transplantation can actually reduce long-term financial burden on the healthcare system, on society, by decreasing the need of ongoing medical care for organ failure. But also, importantly, from where we're coming from in terms of research and innovation, the field of transplantation actually drives research and even innovation in terms of medicine, in terms of leading for advancements in terms of surgical techniques or immunosuppressive drugs and even organ preservation methods. And then the opportunity for living donation in terms of living donors. In the case of kidney and liver transplants that have actually a satisfaction of directly helping a loved one or even a stranger by donating an organ, this act of altruism can actually be emotionally rewarding. You know that I saved someone's life. And then the aspect of cosmetic and functional restoration. Specialized transplantation, actually procedures such as nipple area complex, what they call the ANC transplantation, and face transplant offer what they call cosmetic and even functional restoration for patients who have actually experienced trauma or even disfigurement. So it's important to note, my friends, that while organ transplantation actually offers numerous advantages, it's essential to acknowledge that it comes with challenges, including the need for suitable donors, as I said, the risk of rejection, and the requirement for lifelong immunosuppressive medications. Additionally, specialized transplantation actually procedures often involve complex surgical techniques and may be considered experimental or elective. So the decision to pursue transplantation should actually be carefully considered on an individual basis, weighing the potential benefits and risks. I would argue and understand that from a Ugandan perspective, from an African perspective, people may go in because heavily in terms of the monetary aspects, which I will argue. But how about long-term health benefits? For many transplant recipients, successful transplantation can actually lead to long-term benefits, including improved physical stamina and overall health. How about renewed hope? In terms of organ transplantation, provides for hope for individuals who are actually facing life-threatening conditions. So it offers the possibility to recover in terms of a brighter future. How about argument in terms of what they call reversal of symptoms? Transplants can actually reverse the symptoms and even complications of organ failure, allowing recipients to lead more normal and even active lives. How about arguing in terms of improved organ function? Transplanted organs often function better than the recipient's deceased or even failing organ, leading to better overall health and even well-being. You could also argue in terms of what they call reintegration into society, in terms of the fact that for individuals who may have actually been socially isolated due to limitations of their medical condition, transplantation can actually enable them to reintegrate into society, return to work, and even engage into societal activities. And then if you're arguing in terms of reduction of medications, In some cases, successful transplantation can reduce the need for what they call certain medications for treatments associated with the underlying medical conditions. I think you're evidently noticing that most of the things have got to do with the benefits they have onto people who may have the challenges. How about family and community benefits? Organ transplantation often has positive ripple effects on the recipient family and community, reducing caregiver burden and even promoting community awareness and even support for organ donation. Yeah, we will argue the disadvantages as well. I'm not making a case for it per se, I'm just giving an intellectual discourse so we can comprehend the good and the bad. In terms of research opportunities, the field of transplantation actually presents opportunities for medical research and advancements that can actually benefit not only the transplant recipient but also patients with various medical conditions. I would also argue in terms of what they call enhanced self-esteem. As I said, transplantation, basically, especially in cases of procedures like nipple area complex, what they call the ANC transplantation, and face transplants, can actually enhance a patient's self-esteem and even psychological well-being. Please understand that when you're arguing these, we're arguing them in the point of a person who's having a defect, but also not going to someone who's super normal, killing them or taking advantage of them and taking whatever they have. We'll argue how it is done. So in terms of increased survival rates, transplantation significantly improves survival rates in terms of individuals with end-stage organ failure, giving them a chance to live longer and healthy in terms of lives. I know you will argue and say, but it happens for those who have the money. We're going to look at that as well, because I'm significantly aware that there are quite enormous or outrageous fees that may be involved when it comes to these transplants, especially in terms of the trade that have to do with particular organs as a question of purchase. But I'm also aware that there are free donations that happen where individuals freely donate their organs, especially if they realize that they could save the life of a brother or a sister. So please understand that while organ transplantation offers many benefits, it also comes with several disadvantages and challenges. And I'm going to discuss some of those main disadvantages. There is a risk of rejection. One of the most significant disadvantages is the risk of the recipient's immune system rejecting the transplanted organ. So immunosuppressive drugs are actually required to reduce this risk, but they can have side effects and weaken the immune system. So that's super disadvantage number one. Number two, as a disadvantage, what they call complications and side effects. Transplant recipients may actually experience complications related to surgery or side effects from what they call immunosuppressive medications, which can include infections and even diabetes and even hypertension and kidney problems. So that's another disadvantage. Another disadvantage will be in terms of limited availability of organs. The fact that the supply of organs for transplantation is actually limited, and there is a shortage of organs in terms of the demand. Many patients spend significant time on waiting lists, and that's another big disappointment. And maybe that's why people do it in a bad way. And then long waiting times. Due to organ shortages, patients often face long waiting time for transplantation. During this period, their health may actually deteriorate, and some may not survive to receive an organ. And then obviously, the one that is extremely big is the aspect of the high cost. Transplantation is an expensive medical procedure, and the cost of pre-transplant evaluation, surgery, or even post-transplant care and medications can actually be a significant financial burden. And maybe you'll argue that that's why the people who have the money deal in it. And then there's limited donor pool. Many transplantable organs can only be sourced from deceased donors, and the number of deceased donors is actually limited. Living donors are an option for some organs, but also come with their own set of risks. You'll argue and say, but we keep losing people left, right, and center. How about giving these bodies or these organs freely to these people? That's a question of debate. There's also a question in terms of surgical risks. Organ transplantation surgeries are complex and require inherent surgical risks. So there's always the risk of complications during the transplant procedure. Yeah, and then there's an aspect in terms of what they call long life medication. Many transplant recipients must take immunosuppressive medications for the rest of their lives, which can lead to medication side effects, a weakened immune system, and the risk of infection as well. And then there's an argument in terms of the disadvantage, what they call psychological and emotional challenges. Transplant recipients and their families may face psychological and even emotional challenges, including anxiety, depression, and the stress of waiting for an organ and even adjusting to what they call a post-transplant life. Yeah, and then of course another disadvantage will be in terms of what they call ethical and legal issues. The allocation of organs can actually raise ethical concerns, including how to prioritize the patients on waiting lists, and there may be even legal issues related to organ trafficking and even consent. And then another disadvantage will be argued in terms of what they call unpredictable outcomes. The success of organ transplantation can actually be unpredictable. So while many recipients experience improved health in terms of quality of life, there are cases where transplants do not lead to desired outcomes. So my friends, listen, it's important to note that the decision to undergo organ transplantation is complex and should actually be made with a thorough understanding, looking at the advantages and disadvantages, and in consultation with medical professionals. Transplantation can actually be beneficial in terms of saving and enhancing life, but it is not without challenges or even risks. Okay? And another disadvantage could also be in terms of what they call graft versus host disease, what they call the GVHD. In some cases, transplanted bone marrow or stem cells can lead to what they call GVHD, where the transplanted immune cells attack the recipient's body, causing a range of complications. Yeah, there's also what they call chronic organ rejection. So despite the so-called immunosuppressive drugs, chronic rejection can actually occur over time, leading to a gradual decline in the function of a transplanted organ. And then you could also argue in terms of infections and complications. Transplant recipients are set at increased risks in terms of infections, and some complications can actually be life-threatening. And then you could argue in terms of what they call limited long-term data. For certain types of transplantation, such as face or even hand transplants, there may be limited long-term data on outcomes and potential complications. And then you could also argue as a disadvantage in terms of what they call dependency on medications. So the argument of long use of immunosuppressive medications can actually be challenging due to side effects and the need for strict adherence. And you could also argue in terms of what they call psychological stress. The psychological stress of living with a transplanted organ, particularly in cases of face or limb transplantation, can be significant and even affect the recipient's mental well-being. Yeah, and then also you could argue in terms of what they call healthcare disparities, in terms of assessing or access to transplantation and what they call post-transplant care can actually be unequal, leading to disparities in terms of healthcare and even outcomes. And then we could argue in terms of what they call ethical dilemmas. Yeah, under ethical dilemmas, these can arise when considering, for example, living donations, especially for cases like uterus or even limb transplantation. Yeah, and then you could also look at it in terms of what they call the impact on donors. In terms of living donor situations, such as kidney and liver donation, the donors may actually face their own set of health risks and potential complications. You could also argue in terms of what they call limited availability of specialized procedures. Specialized transplant procedures like limb or even face transplantation are often, limited in number in terms of specialized centers and restricted in terms of access for many potential recipients. So, my friends, it's important, as I said, to remember that while these disadvantages do exist, organ transplantation has actually, saved countless lives, improved the quality of life for many individuals, and each transplant case, as I said, is unique, and medical professionals have to work to minimize risks and complications while maximizing the potential benefits. Again, I'll emphasize that the decision to undergo transplantation is made after careful consideration of the individual's specific medical condition and needs. So that's the argument that I'm making in terms of the advocacy for comprehension. A substantive comprehension is one way of understanding what organ trade is. It's another for you to acclimatize and acquaintance yourself. So in terms of international law, you may not find substantive international law that fundamentally supports because of the illicit trade that has actually gained over a period of time. But we may go through some relevant international agreements and principles that may be argued in terms of the discourse that we are talking about as far as organ trade. The World Health Organization, for example, has guiding principles on what they call the human cell. tissue and organ transplantation. These principles emphasize the importance of what they call voluntary and unpaid donation, and also aspects of informed consent and the prohibition of organ trafficking. Please understand that. We could also look at what they call the Declaration on Istanbul or Istanbul for that purpose on organ trafficking and transplant tourism. This declaration, issued by a group of international experts, condemns organ trafficking and transplant tourism and calls for ethical and transparent organ transplant practices. You could also look at what they call the United Nations Declaration on Human Rights. While not specific to organ transplantation, this declaration upholds the principle of what they call human dignity, non-discrimination, and the prohibition of slavery and exploitation, which are relevant to the fight against organ trafficking. Please understand that. And then you could also argue in terms of what they call the Council of Europe Convention Against Trafficking in Human Organs. This convention, which actually came in force in 2015, specifically addresses the issue of organ trafficking. It criminalizes organ trafficking and establishes measures for prevention in terms of protection and prosecution. So please understand that the argument I'm making here is that these international agreements and principles aim to ensure that organ transplantation is actually conducted with the highest ethical and medical standard, while also addressing the illegal organ trade and exploitation of vulnerable individuals. So they do not support and endorse organ trade, but instead provide a framework for regulating and combating unethical practices in the field of organ transplantation. Please understand that. Now we're going to argue that in terms of the Ugandan context. And in terms of Uganda, the Minister of Health several times has warned members of the public against engaging in organ trade. And they will argue that it is illegal. We have some, we could argue, I remember Dr. Frank Asimwe, a consultant urologist and transplant surgeon, said any donation should actually be purposely to save a life. Actually, Dr. Asimwe says that the commercialization of organ transplant could actually see an illegal harvest of organs from the public, leading to the loss of lives. Now we could argue that in the recently enacted Human Organ Donation and Transplant Act of 2023, it stipulates punishment and detention of up to 12 years or a fine of up to 2 billion Uganda shillings once a person is found guilty. So it's important to understand that. We're also arguing that the number of Ugandans seeking organ transplant obviously continues to rise with, a consultant in terms of what they say. They make a proposition that about 300 Ugandans are in need of what they call kidney transplant, and each of the patients need to find a donor, who will give them this to save their lives. So donors are categorized in terms of what they call brain dead donor, who are nearly dead persons, and then those who are alive, who can consent. So each of these donors have to be warned, for example, against donating any, for commercial purposes. So according to the donor, it's important for them to know and comprehend what they're dealing with, yeah? And it also calls for a careful appraisal of commercialization of donation, so that you could understand. That's why the law gives punishment of up to 12 years or a cash fine of about 2 billion once found guilty when you're dealing with illegal organ transplant. Okay, so it's very, very important for you to understand that that is, whoever engages in that should be mindful of what is the law. So it's important, as I say, that while Uganda has a law that substantially captures a number of these elements, it's not a green light for people to engage in free organ trade without following the ethical or even regulatory or even scientific concerns. The argument is that Uganda may need a period of about 3 years before they can actually get ready to, likely engage in substantive kidney transplants independently. Yeah, and even so, medical doctors have actually warned that these transplants won't be for everyone. The doctors actually cite what they call post-organ harvest care, and which is critical in the process. So in other words, every recipient must actually prove that they will afford the lifetime medication. Yeah. So it's important to understand that organ trade constitutes the sale, as I said, and the purchase of organs, sometimes for financial or even material gain. And the World Health Organization prohibits payments for organs. They did way back in 1987. So many countries, including Uganda, subsequently have codified the prohibition in their national laws. Yeah, and if you're arguing organ trade, it basically would involve a variety of practices, which range from excessive exploitation in terms of trafficking to voluntary and mutually agreed benefits as a trade. So it's important that although reliable figures are actually lacking, the World Health Organization estimated that about 5% of all transplants performed worldwide are actually illegal. So living donor kidney is actually the most commonly reported form of organ trade. So in Uganda, the point is that hospitals will have to seek for accreditation to carry out these organ transplants. And accreditation is said to be on an organ per organ basis, as each organ has got different prerequisites. So it's a complex thing. It's not just a green light. Yeah. So the approval will be done by the Uganda Human Organ Donation and Transplant Council, which has to be empowered by the Act, as it were. And the council has to be established to verify and affirm and even regulate for purposes of that. And so the framework, the legal framework, has to be subject to strict regulation to ensure that there is no abuse, and that's something that is important. I would argue and give an example. Dr. Karya from the Center of Bone Marrow Transplantation and Cellular Therapy in India said that Uganda has a good base in terms of a blank bank and even laboratories. And he makes a proposition in terms of a call for a creation of a national waiting list that would help people to engage in some activities of sorts. But that's a question of debate. The argument here is also that there is an substantive operating center that can be set up at the National Hospital in Mulago, Kampala, to engage in that. So organ banks will also be established for those who wish to donate, not just kidney as well. And it's important that substantive investigation, substantive due diligence perhaps, must be done to prohibit illegal harvesting and also to help comprehend what we're dealing with. And it involves, by the way, even regulatory bodies, both from enforcement bodies in terms of forensic departments, in terms of criminal investigation director, for example, Interpol, cross-border experts, in terms of having a comprehensive appreciation of what we are talking about in terms of organ trade. Yeah? It is reported that there are about 4 cases of unlawful organ transplantation involving 4 Ugandan women whose organs were actually removed when they went to offer domestic services in Saudi Arabia and Oman. Yeah, and the argument here is that 2 of the women, including Millie and Namazi, lost their lives after their kidneys were actually removed. I'm just quoting from newspapers. So Namazi was actually contracted to work in Saudi Arabia, but was trafficked to Egypt, where her kidneys allegedly were removed. And Namazi reportedly died on December 5th, 2021, but her body was only repatriated on January 17th. So although the police may not have released the postmortem report, family members actually claimed that the pathologist at Mulago revealed that her 2 kidneys were actually missing and her private heart had actually been cut off. So it's important that when you're arguing this, you must argue it in terms of anti-human trafficking aspects as well. Okay, and therefore it's important that all these entities come out to protect and to advocate and to defend and to create, as I say, an equitable but ethical trade, for lack of a better word. Yeah, and there are those who argue that there are many of our friends who go abroad and have been targeted in terms of organ transplant and in terms of the removal, in terms of the harvesting, the illegal harvesting that have been done. So international bodies like UNODC has actually argued that people, especially from developing ones, are being targeted, and the trade is more outside, and therefore there's a substantive need for good investigation to take place. In terms of UNODC, what they call the United Nations Office on Drug and Crime, the report describes organ transplant as one of the notable medical inventions, if you like, in terms of the history of organ transplant, which stretches way back as far as 1950s, when a successful transplant was actually done. Yeah, and if you're arguing that in terms of the global observer and even databases on donation and even transplantation, it shows that about 100,000 kidney, liver, and even heart, even lung and pancreas and small bowel transplants were actually performed in 2013. The data indicates that quite a number of transplants, about probably 80,000 were for the lung and about 25,000 for the liver. Yeah, so these are arguments that create a lot of concern for our humble people in this country, knowing how desperate sometimes we go through. Yeah, but sometimes before we make sweeping conclusions about our loved ones who may have lost certain organs, it's important, as I say, to carry out substantive investigations by the powers that be, including the story that went viral of Namazi, who was allegedly murdered in Egypt after having undergone to do some kind of labor. So it's important. It involves methodical and even procedural aspects and complex investigations, considering the fact that some of these things take place in foreign jurisdictions, in Egypt, for example, for the sake of that individual. So it also involves aspects in terms of prosecution, the DPP, the Attorney General, Interpol, Foreign Affairs. Yeah, all these aspects have to be put in sync so that we could understand that substantive due diligence is done to protect our loved ones in terms of some of these challenges. The argument here is again that NODC indicates that about $600 million was actually earned through illicit organ transplants. The kidney lasts for about 48 hours from removal transplant, pancreas about 12 to 18, liver about 12 to 18, lung rope about 2 to 4 hours in terms of lifespan. But it's important to note, as I said, Uganda has a crucial law to safeguard its citizens from rampant illegal organ trade in terms of trafficking. So the Uganda Human Organ Donation and Transplant Act 2023, already signed and sent it over by the President, has substantive, protection in terms of protecting the stealing of human organs and tissues. And therefore, we are lucky perhaps in one way or the other. The other question is whether or not we are substantive entities that can protect and guard against the abuse. If you're arguing in terms of the Uganda Human Organ Donation and Transplant Act, as I said, Uganda has regulated donation and transplantation in terms of human organs and these tissues. Although it is important to know that the law strictly prohibits any commercial transactions involving human organs and even tissues. So the law basically aims to eradicate the illicit trade that has really flourished in the absence of stringent regulations, with their consequences for vulnerable individuals and perpetrators in terms of organ theft or even trafficking, or in terms of penalties including life imprisonment and even hefty fines. So the absence of a legislation in the past has allowed what they call organ trafficking to flourish, resulting into substantial profits for criminal networks. We could argue that a report by United Nations Office on Drugs and Crime, UNODC, revealed that the illicit organ transplant trade generated about, as I said, $600 million in 2015, exploiting individuals from developing countries seeking for better opportunities abroad, and these networks have actually taken advantage of the lack of these regulations. Yeah, please understand that prior to the enactment of this particular legislation, in the case of Uganda faced challenges in terms of meeting a high demand for organ transplants, and many citizens were forced to seek medical care abroad in countries such as India, United Kingdom, and Kenya. So while organ donation and even transportation were actually available solutions, this resulted in what they call substantial financial burdens for Ugandans seeking these life-saving procedures. So, as I said, the new law, or the law as it is intended to put a stop to illicit trade, but also, paves the way for organ transplantation to take place within Uganda itself. So with the establishment of Uganda Organ and Transplant Council, for example, responsible for regulating and overseeing donation and transplantation in terms of activities, the country here is looking to get well equipped in terms of offering these services domestically. And Mulago National Referral Hospital has been designated as a pioneering transplant center. Additionally, what is important to note is that the law again emphasizes the importance of obtaining proper consent for organ donation and transportation, respecting the dignity and the identity of individuals, recognizing cultural, spiritual, and even personal beliefs for both donors and their close relatives, ensuring that the process is conducted ethically and considerately well. And therefore, the argument is that by criminalizing organ trafficking and providing a legal framework for organ donation and transportation, the argument is that Uganda aims to protect its citizens, to promote a well-being for those in need of life-saving procedures. So the argument is that the Uganda Human Organ Donation and Transplant Act will definitely, or is intended to make a significant step towards ensuring equitable access to healthcare services and addressing growing challenges of a non-communicable disease in the country. So please understand that Uganda's enactment of this particular act, the Uganda Human Organ Donation and Transplant Act, reflects again its commitment to combat organ trafficking, to protect the rights and the dignity of citizens, and therefore the argument is this comprehensive legislation will provide a much needed legal framework to regulate organ donation and transportation, offering hope to many patients that have actually grappled with the terminal illnesses for long. So please understand that in spite of that, as I said, I've been able to argue for you the strength, the weaknesses, and the way forward. And I've also been argued in terms of a necessary evil that we have to live with. It's something that in the absence of it, the alternatives are worse. And when you argue, if you've seen some of the books that we've been writing, for example, cannabis, Njaga, or and cat, Mira, the need to legislate and decriminalize, even arguments in terms of prostitution, for example. There are countries that thrive on prostitution as an entity. I mean, leave around the fact that it's the oldest trade. The argument of how do we enhance and create an environment where countries can actually gain wisely out of them without arguing trivialities in terms of simplistic arguments in terms of religion versus what? Actions. But in terms of understanding that these are sometimes necessary evils. The whole prostitute saved Israel. You look at the Bible, those of you who read the Bible, you know, when the Lord said, when you go, do not kill the harlot. God was aware, even called the harlot. And I'm not making an advocacy for that trade. I'm just saying that sometimes it calls for us to think outside the box and throw the box away. There are many things we need to think about. I wrote a book on witchcraft and the law. The argument in terms of how you deal with an omniscient threat, an omniscient present here. What are the ingredients? Now I'm making a proposition in terms of the argument of organ trade. And I'm not saying I'm going to donate my liver, but I'm just saying that there are possibilities that are going to happen. So these are substantive things that we need to think again, thinking outside the box and throwing the box away. Please understand that the act as we have it today for example, the act imposes life sentence for anyone who removes a human organ, tissue, or cell from a living donor without the consent or even authorization, and prohibits the sale of these organs for financial gain. Okay? And even the act also goes ahead and says corporate bodies will face penalties of up to about 10 billion for being involved in human organ trade, for the same offense. So individuals, including health workers and traffickers, will have a fine of about 2 billion for imprisonment, not exceeding 20 years or both. The act, for example, also prohibits monetary and any other form of compensation for organs and tissues and cells other than reimbursement for donation related expenses, except for just favorable expenses approved by the council. So these are arguments that we're talking about. The act also is intended to protect vulnerable people, knowing where we're coming from. We're living in a country where people are living on less than $1 a day. So to understand the heavy monetary burden that we have. But in spite of that, ethical and moral should never be compromised. The act also provides for Mulago National Referral Hospital to be considered as a designated pioneer transplant center, but also allows for other hospitals who also may wish to designate and transplant as a transplant center opportunities to apply the council in a manner that is prescribed by the minister. It also sets out some key qualifications for what they call designated transplant centers that have intensive care unit, and even high dependent unit bed dedicated to the transplant program, connected with to the theater by a sterile corridor, or even what they call interconnectivity with dialysis capacity or capability. Specialized medical professionals, including transplant surgeons, physicians, anesthesiologists, intensivists, transplant nurses, qualified and even experienced types of organs, tissue, and the likes. Yeah, the act also emphasizes the importance for approval in the organ cell and tissue banks in Uganda. It provides for policies and procedures for approval with the National World Bank, for example, to be accredited by the Council in terms of preservation and storage of the organ. The Council is also supposed to be established as an organ donation and transport quality control system to ensure equitable access to quality donation and even transportation in terms of services and donors. And the importance of ethical standards and even educational services of the public has to be laid out and has to be designated in terms of these transplant centers to produce or even have available literature and media in terms of providing education and awareness for these donations. So these are substantially extremely important issues. Yeah. As I say, when I'm making these positions, I could argue also in terms of the Anti-Homosexuality Act that came into place, and my argument could be argued in terms of nature versus nature. Whereas I'm mindful of the law in terms of what the UN conventions may say, Article 2, Sabbatical 2, no, 9, Sabbatical 2, then also relate that to African Charter, 9, Sabbatical 2, and then relate that to cases like what? Like Eric Githari versus NGO Board, in terms of Nawagasera versus what? Attorney General. All those compositions, you could make that debate and the arguments that are proponed, but the argument is to be alive to the fact that we're living in an entity, living in a country, living in a world that is moving. Talk about AI, for example. AI in terms of artificial intelligence or in terms of legal personhood. So when we're here at suigeneris, our emphasis goes beyond the obvious, beyond the simplicity of arguments, beyond feelings and emotions, and creating solutions so that we can be able to have a much better country, a much better breast country that is ready to accommodate and understand the kind of challenges that we are living in today. So my friends, please be blessed. I'll not even make serious advocacy for examples of certain cases that happened in 2022 where the parents of one Namuli, a senior folk girl who actually committed suicide, if you remember, upon conducting a second postmortem, Lubogo suspected that they discovered that her uterus had actually been missing. These are questions that we're talking about, that we have to be mindful of the evil side of organ trade, the evil side of organ trade, which has actually been captivated on and taken over by mafias, like people. And I'm not making an advocacy about that. I'm just saying the law should look out for such things and be able to bite, if it means to bite, to protect our loved ones, especially our young loved ones who are going to those countries abroad, only to be taken advantage of, or even only to be exploited because of ignorance of the law or ignorance of some of these components that have to do with their health provisions. So as I say, please understand that this is a very important subject, but we have to, as I say, carry it out with a pinch of salt and be mindful and be vigilant and be ready to accommodate the future as it changes. Once again, my name is Isaac Christopher Lubogo here at suigeneris. Please visit our website at lubogo.org, suigenerislawup.com, and be blessed, and thank you for your attention.